Hi friends, welcome back. Thanks for being with me on these disease education sessions. So this is the final session that we have for you, and this is where we are going to talk about how you can get out of this mess that has been created. So let's try to find out what is it that you will have to do differently, or if you are a family member, what is it that your deceased would have to do differently in order to get out of the mess that has been created. So let's go ahead. So again, this is about recovery and not about the disease. Okay, we are focusing on the treatment part, so be very watchful. We have understood that this is the difference that we have, the super stimulant effect, that is the glutamatergic system is extremely active in the addict's brain, and that tilts the balance towards the towards the glutamatergic system, creating a demand for dopamine, and that is how the compulsive consumption starts. Mind you, you could be in the earlier stage where the preoccupation could be a part of the disease process. So your journey may not necessarily reach the compulsive consumption. It could be preoccupation, planning, scheming about procuring of the disease. And that itself is suggestive of the problem that exists, the superstimulant effect that your brain probably has succumbed to. If that continues, then we know that there are various areas of the brain that can get affected. There are various other neurotransmitters which belong to or which are placed around this area called the addiction center. And when they keep getting affected, then we know that different kinds of behavioral changes can set in. So it could be the pharmacological problem, that is the tolerance and the withdrawals and the fear of withdrawals, the anxiety, sleep issues, all those could be there. It could be, the co-occurring disorders that can come in. So you could have hallucinations, you could have behavioral problems which are not necessarily restricted only to the substance use. Denial becomes a significant part, and I'm happy that you are here and watching these videos, because the best way to overcome denial and accept the disease and its treatment is understanding the science behind it. So that is what probably happens through the cannabinoid system in the brain, and the chronic relapsing part, that is the stress and the emotionality that gets your goat. What happens is, every time you are stressed out, you would think of only one solution. The brain throws that solution, it narrows down your options, and it convinces you that the drug of choice is the only solution to calmness or peace that you seek. And that is where the insanity begins. Okay, we always say that insanity is not about what happens to you after you consume, but it is something that happens in your mind before you consume. So as Einstein, I always keep quoting him, that you keep doing the same thing and expect a different outcome. So every single time the mind convinces that the next consumption would be a controlled consumption, and that is where the problem keeps repeating. So whether it is stress, whether it is boredom, isolation, loneliness, the only solution seems to be the drug itself. And that is where the key problem keeps happening. Okay, this is where the picture is a real positron emission tomography picture, and you can see these spongy things around, and these spongy things are nothing but one area in the glutamatergic area affecting the nearby areas. So it's not restricted to only the basal ganglia, as we say, but it starts reaching out, the chemical changes start percolating into surrounding areas. That is where the co-occurring disorders happen. We saw that there are various kinds of co-occurring disorders that can happen. Each and every substance can cause some mental illness or the other. So we always say that all the psychiatric illness can be triggered by these addictive substances because of the chemical changes that they can bring about. Now what is important is that what are the things about the addictive disorder that we can change and what are the things that you can't. Now, I am in India, and obviously I'm a cricket buff. So I'm going to give a cricketing example. So what we know is that cricket is played in many countries, and each ground has its own nature. The soil, pitch decides the bounce and the movement, everything, right? So you can't have a Melbourne cricket ground in Wankhede or Mumbai, okay, because the soil is different. So things in our body that cannot be changed, that's genetics, okay. Now that cannot be changed, okay. Then there are some variations, and those variations are climatic conditions. Sometimes in Bombay it rains and the Wankhede pitch can be bouncy, okay, but most often it would help the spin bowling as the pitch ages, okay. So these are the climatic changes which are variable, but the basic nature, that is the genetics, would remain the same. So epigenetics, these in medical science it is called the epigenetics, okay. But some part of the epigenetics, okay, is controllable and some part isn't. So social attitudes and supports and that can change only through awareness. So yes, we need to, as we start treating this condition as a social issue, then there are certain policies that need to be implemented. There are certain prohibitions that need to be implemented. But for the individual patient, that's a far-fetched idea. As a society, we need to have a community coalition in order to create those policies. So there are some parts of epigenetics that are beyond our control. So let's try to forget about those. So what are the things that are within your control? So rules of the game. So we have 50 over match, we have a test match, and we have a 20 over match. Yes, we can have separate rules which can be decided, and then your approach also needs to be different. You can't have the same approach towards the test cricket and the 2020 match. So what it means is there are certain aspects in epigenetics, that is family and workplace, the attitudes of people who are around the addict or an alcoholic, all those things can be changed. What are the changes that need to be done? So some players, okay, some cricketers have that innate ability. So some people are good at 2020 but not too good in test cricket. So similarly, we need to have some kind of a coaching facility for what is the role of the things are in the surroundings of an addict that need to change. So you require a therapist not only for the suffering addict or an alcoholic, but for his family members also, because they are the part of the epigenetics that these addicts and alcoholics live in. So those are the things that also need to be changed. So that is the reason why we say that family programs, family therapy, family support groups are also as important as addicts being in the recovery program. So that is where probably we would require your family members also to get involved in these treatment programs. And of course, the coaching facilities, the leadership decide the consistency of outcomes. So you would require in the early stages some kind of information that is evidence-based, that is experience-based, which will lead you in the right direction. In the journey, it's not every single time that you succeed at the first moment. There are failures. There are attempts that we have to keep repeating. And that's the reason it is important that once you know what is the right direction, you need to persist in that direction. And the best way to do is that find a coach who is knowledgeable, and second, find the support system which is able to guide you during the times of crisis. So we need to find out what are the things that need to change in your epigenetics. So try to get the best coach, try to get the knowledgeable people, try to get the expertise, and try to fit in the support systems in your day-to-day life. And it's not only about the addict, but it is about his or her family also. So the family therapy, individual guidance, both are required. So let's try to find out if these are the things that the person has to work on. So he has to overcome his denial, he has to work on his acceptance. not only that it's a disease, but it's his responsibility to get well. So acceptance is not about only the disease concept, but it's about the treatment also. It's just the same in diabetes. Accepting that I have diabetes would not lower my sugar levels unless I bring about a lifestyle change and take the pills if prescribed regularly. So acceptance is not restricted only at the disease concept, but even the treatment in its fullest and the realistic form. So yes, acute withdrawals, yes, you need to live through them. No pain, no gain without pain, that's what we say. Most of the withdrawals would be managed by the experts and they will become tolerable. But what is important is that even if you go through a bad withdrawal, it's worth going through it, because the life beyond a withdrawal is much, much easier and simpler. Withdrawals are acute, they are short lasting, and later on life becomes easier. So it's worth going through this. Impulsivity, emotionality, stress, vulnerability, there are lots of interventions like cognitive behavioral therapy, group support therapy. There are certain interventions that happen through the group which will identify in what way you need to change. There are some assessments which will let you know exactly what thinking patterns in your mind need to change. There are certain assessments which will try to make you understand what are the defense styles that you are using in crisis situations. And when in crisis, how do you land up in this common thought process that the drug is the only solace? And that once you understand, you try to work on them, and then the thought process starts going in the other direction, which will take you towards health. Stress vulnerability. Yes, we can actually find out what are the neurotransmitters in the brain that are affected. So when you have those neurotransmitter questionnaires, all these are paper pencil tests, and they reflect as much of you as much as your honesty. So if you're honest, then we get a lot of information. So those are the tests that we would probably have to do in order to understand the mind as well as its workings better. And if you understand where the mind is playing a prank, then we both together will be able to go against the prank and have a winner there. But all these things are individual. But I said that there are some things that need to change around you also. So just changing I is extremely important, okay, no denying that. That's the most crucial thing. So we always say that you alone can do it, but you can't do it alone. And that is where I feel that we becomes extremely important. So who are the we that we are engaging with? Yes, of course, you and your family, the most precious asset that you have. Believe me, right now things might not be as good as they really are. But believe me, your family is one good asset that would probably leave you last. If the family has been totally disturbed and currently not not a good resource for you, nothing is lost. You still can fight it and make it. But if the family is there, it might become a little easier for you. Apart from the family, we'll have to work on awareness and acceptance. Okay. Now, who is going to become aware and accept? Okay, not the entire mohalla that you live in, but it's the close acquaintances, the close family members, the friends, okay, with whom you interact on a daily basis. So they need to be educated about your problem, and just the way they would not insist if you had diabetes to eat a pastry, they will have to learn a few ways of leaving some of the boundaries that you are trying to draw. So you will have to draw the boundaries, and they will have to support you in those boundaries. Okay. The third thing is that the family work and attitude, because you spend most of the time apart from your work with your family. So the family needs some kind of suggestion, some kind of directionality, some kind of information, some kind of attitudinal change when they look at you. It's not necessary that they don't care for you, but obviously sometimes out of the care that they have for you, they might just be making a few adjustments which are not really required or may be harmful to you. So we would try to get them together and try to figure out what is the best way they can support you to recovery. Not to please you, but to recovery, for your own recovery. What is the best thing that they could do? This journey may not be as pleasant as possible as you believe it could be. It's not about family saying yes to everything that you would or probably want. What is important is that your thinking and feelings need a certain kind of direction and discipline. You need to understand that even if you get disappointed for some reasons, your mind has to learn to choose an option which is healthy for you to live with, rather than the current unhealthy choices that your mind is repeatedly making. So for that, you need to be trained through the individual therapies, and the family needs to be engaged in some kind of support groups, support activities, support programs. Their own mental health issues need to be resolved, and that is where they need some therapy. Again, for that you require expertise as well as the community networking. So that is where probably you will have to work as a family, and Samarpan and any good kind of therapy program would address all these issues. Okay. So where do we get these V's? Okay. That's an important thing, because family is there, but where do you get the community support from? Okay. So strong recoveries and wrong recoveries, what are the characteristics? We know that desire, okay, that's the first part. The desire has to be in the mind. If you don't have the desire to do something about your life which is just on a destructive mode, nobody can help you. So you have to have the desire to bring about a change. And not only that, okay, you have tried it enough yourself, and if it is not working, then you need to get a knowledgeable advice. So first thing that you need to do is you have to learn to listen and listen to learn. Okay. So once you have the desire, okay, and willingness to know more about how people get out of this disease. Okay. So you will have to have that willingness to connect. Okay. You will have to connect with somebody the same way that you have connected with me. You will have to connect with your therapist. You will have to connect with people who have already experienced this life. Okay. So you will have to connect with people and form new relationships. Okay. And then you will have to obviously listen to them. It's not possible that you would agree with everything that they say. They are telling their knowledge, they are sharing their knowledge with you. It could be a counselor, it could be an expert, a psychiatrist, psychologist. They are sharing their wisdom with you. And people who have the lived experience, they are sharing their lives with you. Now you have to find out what is going to suit you best and how will you be able to apply it in your own life. But currently your thinking, feeling and behavior, as I said in the first session, has been hijacked by the disease. So it becomes rather difficult to differentiate between what are the thought processes that are the hijacked ones and what are the thought processes that are your real ones. So the best thing to do is that in the initial stages, what you need to know is that maybe just go by what others are saying. And for that, you have to have a trusting relationship with your therapist. And once you have a trusting relationship with your therapist, then walking the talk becomes little easy. Not too easy, little easy. It's going to be a difficult process, not an impossible process. But you have to give in to that process. Okay. And you have to learn and listen and read. Of course, read a lot, whatever. But get information from authentic sources. Okay. Then yes, the proof of the pudding is in eating. So you have to start work on your quitting date. So if you've already not quit, then set a quit date. Okay. And just go ahead with finding out what is it that you need to change in your life if you wish to quit. Okay. And the third is, well, if you have decided the quit date, we have decided to change, then you will have to commit yourself for that change. Most of the New Year resolutions get totally forgotten by the 10th day of January. Now, what is it that if you want to sustain your motivation, sustain your resolution of bringing about a change, okay, what is it that you would have to do differently? We say that the birds of the same feather flock together. So you would have to be with a motivated group of people who have had this shared experience. And that is essential because your therapist cannot be available all the time. Okay, your counselors, your doctors, okay, they have a 24-hour day, they would work for 8 to 10 hours. But beyond that, they would not be available. So you would have to find some kind of a support group or support person which is available just around the corner. And that is essential because, well, the disease does not follow office hours. So it can come as craving any time of the day. And you will have to get some support from somebody in those days, because what we know is the post-acute withdrawal syndrome or pause that we talked about, I am alkiest. You remember from the second session, I am alkiest. You know, that can come up suddenly anytime, and 20 to 30 minutes of communication with a person who has a lived experience could just go, you know, the craving just dissolves in those people. Okay, so what we know is you will have to have some kind of engagement with people who have a shared belief and willing to act when you require them to act, and you have to have a trusting relationship with them. You can't be getting help, okay, when you want. You will have to create opportunities for you to reach help. Okay, and that is where it is extremely important that you work on creating this community called we. Okay, and that is, do I know the ground? So well, in addiction there are some ground rules. Do I know the ground rules? That is precisely what you are listening to. Okay, so this is education and treatment education. Okay, what is disease education? Compulsive treatments work in co-occurring disorders when the person has the so-called inability to take a good decision for himself, okay, regarding his mental health. It may extend for about 10 to 15 days, maybe a month, okay, but not beyond a month. After that, whatever treatment happens has to be voluntary with the consent of the patient. That is the best outcome way of approaching a mental health issue. Whom do I have to connect? Obviously, knowledgeable, supportive, and experienced. What do I have to learn? How to stay stopped? Okay, how do I? Stopping is very easy. Okay, I keep saying that. But how to stay stopped? And for that, we said that we require a relapse prevention plan. Now, in that relapse prevention plan, you require motivation to implement it day in and day out. We always know that, you know, initial enthusiasm is very good. I've decided to quit. The motivation suddenly goes down, and about 4 to 6 weeks we have seen that, you know, the early stages of recovery and the enthusiasm makes you feel that you have overcome the problem. Okay, and that motivation can last for some time, and then suddenly in this recovery you reach a stage where you reach a wall and you don't progress, and when you reach a wall you become vulnerable to a relapse. The relapse mentality can be triggered by those people, places, situations and things, or internal triggers, hungry, angry, lonely, tired, and when that happens, then it becomes extremely difficult for you to control it further. And when that happens, well, you are very close to the relapse. So keep learning, keep rehearsing, keep giving, and keep living. That's the motto of recovery. Now, in community, there is something called the 12-step program, and there is something called the modern 12-step. Okay. Well, I believe there is no change, no difference in both the two. Whether you believe in God, you don't believe in God, there is no, if you feel that you are God, then there is a problem. Okay, so what we need to understand the steps, okay, that you need to bring about if you wish to recover. Okay, so what does it say? You have tried it yourself. Okay, You want recovery, you want a good life, you have tried, so you accept that I can't. Right? When you reach out to people who have recovered, okay, the STEP program says that something can. Okay, I can't, but something can. Now they call it that something God. Okay, so they say something can, something helped us. Okay, now if something has helped him, that I would like that something to reach me. So let God. Okay, and then it says that yes, God helps those who help themselves. So what do they have to do? Rather than finding out fault in the whole world or their family or their fate, they say, look within. Try to figure out what is wrong with you. Okay, that is where understanding yourself, soham, becomes extremely important. So look within. Okay, try to find out what are the wrongs that you have been doing in order to facilitate your journey in addiction. So at least remove those wrongs. What is it saying is that if there are certain things that need to be changed in your thinking and feeling, which are taking you in the wrong destination, then better change them, because nobody else is going to change that thing. So whatever that is internal needs to be changed by yourself. Okay, so look within, find out what is wrong and ready yourself for change. Now when you are changing, well, the changing cannot happen only at thought level. We need to put it into practice level, because as alcoholics and drug addicts, okay, they are mostly extremely sensitive. And fear, anger and resentment, these are the three things that keep bothering an addict. They are exceptionally moralistic. I say it very responsibly. They are exceptionally moralistic, but the disease takes them to a state where their morality is completely hidden. So they know what wrongs they have done, and that wrongs many a times burdens them, and that burden, that guilt, shame, embarrassment turns out into fear, anger and resentment. And that keeps bothering them. And that is where you need to put your action plan of change into practice. And that is the reason whatever wrongs that you have done, okay, if you feel that it needs to be changed for the better of yourself and not harming others, then you need to bring about a change. So what you're doing here is you are changing your coping skills. You are accepting yourself with all your wrongs. And when you accept yourself with all your wrongs, you feel relieved, unburdened. That increases the efficiency of the brain, and you would require every inch of that efficiency in order to fight this disease. And that is where the program keeps at. And then 10th, 11th, 12th is what they call as maintenance steps. Okay, so whatever change that you have brought about, there are certain things which are inherent in an addict and alcoholic because of the genetic influences, the soil and the pitch which cannot be changed, the genetic influences. We will have to work on that. So we can't change. So we need to be mindful about those genetic vulnerabilities. So we have to keep checking whether those genetic vulnerabilities have come up again, have started interfering with the thinking, feeling and behavior that you are practicing in recovery. So these are the steps, okay. So, well, the 12-step program says that, this is the triangle and you need to change. And what does it have to change? Thinking, feeling and behavior towards self, family and friends. And we need to change. The family also needs to change. So, the recovery is not restricted. The changes in recovery are not restricted only to an addict, but they probably are preferred to happen in the family also. The modern 12 steps do not say anything different. Okay, they just remove the part of surrender and the God. It's your own preference. Okay, what needs to happen is that you need to probably know that you require some knowledge, trust. You have to follow that faith and trust. You have to accept, forgive, remember and help others. So when you keep helping others, which is the 12th step, the final step, where whatever you have learned, you keep sharing with others. And that has proven wonders in tobacco cessation. Okay, the more you engage yourself with a movement, whether it is climate change, whether it is tobacco cessation, any change, the more you commit yourself to it, your motivation to follow the simple practices required for that movement, thought movement process increases. Okay, so it's not something that is different in all kinds of social issues. The more you engage in the whole thought process, better it is. So that is what happens. So you have recovery facilitation therapy, then there are various kinds of individual therapy, and last is pharmacotherapy. So if you have a dual disorder, if the genetic influences are strong and you do require some kind of anti-craving medicines, then yes, you should remain open for it. I always say that you will have to choose your own basket, and that basket needs to be chosen with the right kind of an expert. Usually the anti-craving medicines have limited role to play, but it is significant when I say that for each individual, the improvement that can happen with anti-craving medicines makes a significant change. So you try it out. Are you going to take these medicines lifelong? Not at all. Usually a course of 6 to 8 months is what I advocate, but in those 6 to 8 months, it is better and it is preferable that you choose to learn all the relapse prevention strategies. So after 6 to 8 months, there is a high chance that you would not require these anti-craving medicines. If you do, no problems. You can take it through the closest expert that you have with proper kind of monitoring. If that happens, it is certainly safer to consume anti-craving medicines and be sober than consuming alcohol or the substance of choices that you might have. So it is always better. It's a legal substance. It has side effects. They need to be monitored, but those side effects are not as bad as the illegal ones. So what I'm trying to say is the usual roadblocks. Okay. The maintenance steps, as I talked about. So you have to keep in touch with the support system, because if at all, okay, anything is shaken here, then you could have emotional issues, the mental issues, and the relapse. Okay, so we have seen this relapse process in our second module, and in that we know that the commonest cause of relapse is keeping away from support systems. I don't need the support systems, overconfidence. If I have overcome my disease, the disease is not curable, it is controllable. So always keep this in mind. It's just like diabetes. So you have to sustain your motivation to maintain your blood sugar levels. You have to sustain your motivation to keep you away from the substance of choice. If you are able to do all these things, then you would learn something about it. Okay, so some people don't learn, then death and insanity is the outcome. But believe me, the commonest outcome is recovery. The commonest outcome in all kinds of addictions is recovery, and death and insanity happens in small numbers. Some people learn from their own experience and they restrict their learning from own experience. They have recoveries, but they have them pretty late in their lives. Okay, some people learn from others' experiences. When you learn from others' experiences, we call them smart recoveries. And if some people keep learning about their problems, then we have strong and long recoveries. Now, I wish you strong and long recoveries. In order to have the strong and long recoveries, what we need is, of course, your desire to bring about a change, then your willingness to connect with experts and experienced people who would be able to not only guide you, but support you in times of your need. And the third is commitment towards the cause. Now, if you have this, you will see a wonderful life beyond your addiction. And that is where, if you explore yourself, the disease, the world of recovery is just round the corner. Thank you very much for seeing me in these videos. If you have any difficulties in understanding any of the concepts, if you want to know more, then please connect with us at Samarpan, and we are there to help you. So I wish all of you a wonderful early recovery. So all the best and see you soon.